Hello everyone, welcome to The Voice of Nursing. My name is Adrian Tracy, I'm CEO of ICG Medical. Today joined by Parveen Ali. Welcome Parveen.
Thank you, Adrian, to have me here on the program. Thanks a lot.
Thank you, Parveen. Parveen, tell us a little bit about your background and how you got into nursing.
Okay, so my background at present, I'm working at University of Sheffield as a senior lecturer in School of Nursing and Midwifery, of course. So I am a nurse by background, and but my initial education, which is up until master's program. So I started off doing diploma in nursing and diploma in midwifery, which is usually, if you look at in the UK context, it's after your GCSEs, you do it. So I joined that in 1993, completed diploma in nursing. It's a 3-year diploma program in nursing and then 1 year in midwifery by 1997. And then I did my post-RN, which is post-basic nursing education, like, once you're registered, but then you go for completing your degree in 2000 and completed master's program in 2004 from Aga Khan University School of Nursing, Karachi, Pakistan. So my initial training, initial education is from Karachi, from Pakistan. I moved into UK in 2005, and since then I worked, then I completed my PhD, which was in public health, health and related research from University of Sheffield in 2012. And between 2012 2014, I worked at University of Hull as a lecturer, and then came back to Sheffield in 2014. And since then, I was here as a lecturer first, and now as a senior lecturer. In between, I have worked in terms of my clinical position. So I have experience of work in cardiology, intensive care, telephone triage services, and dealing with people who have dementia and elderly mental illnesses. So that's my kind of background. In terms of my research, I look at gender-based violence, domestic violence sort of aspects, in generally in BME communities and generally otherwise. And yeah, so that's what I do.
Fantastic. It's all good because obviously nurses go various career opportunities and different paths and what have you. How come you went from that sort of clinical setting into the academic field?
Okay, so if when I started off doing nursing, or in the past, let's say 10, 15 years or 20 years back, people used to think there was only limited options. Like, for example, either you could work in terms of people's perception, it was that you could only work in clinical area. But those who are nurses, we know that it's very different job. So you used to have the option of working in the clinical area, which is clinical nursing. Then some people would go into management, and some people could go into teaching. So that's the sort of 3 main elements. Broadly speaking, probably these are 3 main elements at the moment as well. But people used to think it's only hospital, but nursing is not limited to hospital. It's or to the clinical area. It's a very, very, very vast field, because wherever you talk about health, nurses are they are the bridge between many disciplines, if you like, and they probably are those who spend most of their time with patients in different capacities. So it is relevant, and yes, you could work in many different areas as you like. Now people work in as a travel nurses. Nurses work as researchers, where we look at, like, for example, my own field. Up until few years ago, people didn't used to think that domestic violence is something that we should be concerned about, or if that is our role. One of the other aspects of my research is looking at cousin marriages and genetic risk associated with it. So genetics and those kind of genetic risk related aspects, or increasing education. Perception was that nurses don't do that, but no, that's true, because you see, you understand people more, you have got the ability to impart knowledge, or to give the message into very simple and very jargon free language. So I think it's a myth, but sad thing is that it is still a myth, and people, still the knowledge about nursing, that what nurses can do and what nurses do in different settings is still limited. People still do not really understand the role of nurses.
Mhm.
And
Tell us
I
a bit
think
more
that's
about
very,
that. Tell us a
sorry?
little bit more about that gender-based violence and that sort of the inequalities and health work you do. 'Cause that's, very interesting from a nursing perspective.
Yeah, so in terms of my research, as I said, that I look at gender-based violence, but the main theme which goes through it is inequalities in health related to gender and ethnicity. So in which I try and see how being different socioeconomic factors or different titles that we give to people, like for example, gender, for example, your ethnicity, for example, your socio-demographic sort of where you live, how that has an impact on the accessibility, acceptability, and provision of services to those people. And I think that is a very big issue, and it's both ways really. And domestic violence and gender-based violence comes one of those elements, because people usually domestic violence happens everywhere, in all communities, in all settings, in all socio-demographic groups. So it's not that it is only limited to deprived areas or people with low socioeconomic status. But you would find that when people are trapped or people have those factors like ethnicity included, some of the other aspects in social poverty, the impact of the issues gets much more worse, because then people struggle to access services. They don't always have information about how to access services, where to go to get that information from. There is usually trust and mistrust related issues. People struggle with having appropriate money to support their daily activities, let alone think about other aspects. So I think my work is around that, and my work is also that how you can prepare a healthcare professional. So I work with nurses and healthcare professionals to see how we can actually help them be more prepared to be able to deal effectively with people from marginalized populations, with people who are affected by inequalities in health, by understanding factors which affect their ability to access those services, and by exploring what is it that we can do to help them by actually looking at our own attitudes towards different things, which may result in some kind of unconscious biases, sometimes not knowing what the other person wants and thinking, this is the standard, because you try and kind of give standard sort of treatment to everybody. You try and do good for everyone, not realizing that that good probably is not enough for certain groups, and you need to have a little bit more knowledge about it. So for example, domestic violence, people can use culture as an excuse very easily, or religion as an excuse very easily. And if as a nurse you're not tuned into, you wouldn't be able to challenge them. And if as a nurse you don't understand what would help, let's talk about women, then you wouldn't know where to refer to them, what sort of issues they're going to face. So one very good example of the recent work which we are doing is like how to prepare nurses to ask questions about domestic violence from different people from women who you think probably are affected by it. So it's a simple thing like asking questions: are you experiencing any kind of violence from your partner? And the general notion is that you would think that's an appropriate question, but you wouldn't think of saying or any other family member, for example. So having those kind of understandings, having those kind of issues that make people more sensitive to the needs of others, for example. This was just one example basically, but it's just trying to do that kind of aspect, and I think that's really useful.
And how are you sort of measuring the success factors of that?
I think measuring success factor in kind of in a quantitative manner is probably, it depends on what questions are we asking and which topics are we looking at. So for example, if I look at the work which I do in terms of cousin marriages and genetic risk associated with it, our aim is to increase genetic literacy among community at the community level, so that people can make informed choices. They know why something is happening. They know what is recessive inheritance. They understand what goes behind it, and they know what services are available. They know where to go to get those services, so they can actually make those informed choices when they are looking for their options. And I think that's difficult to measure because for the various reasons. One is the issue affected is at the population level, it affects very small number of population. On the other hand, if people do something, access services or something else, and do mention, this is what happened, you probably would know it, but it may be that they don't do it at that time, so it may be few years down the line. So, how would you actually see? So you would only see the difference maybe down the line in few years time, but this is only one factor. So for instance, if you look at infant mortality rate, that it's going to decrease if you deal with it, but then this is only one thing which would help decrease infant mortality rate. There are many other things that you have to work through, and then it's difficult to attribute what has made the difference to this decision. And same with domestic violence. I think that probably is slightly easier because we can already see, when I was doing my PhD in 2008, at that time it was very difficult to find any nurses or any doctors talking about it. So we used to provide care to people. We used to be concerned about the issue, but our role was seen as, or we ourselves have seen our role as dealing with the symptoms. Dealing with, okay, fine, if someone is being affected by it, we are there to support them and to manage their injuries and do rest of the stuff. Seeing beyond that was not that much of a case at that time. Over past, I would say 10 years, 8 to 10 years or so, the awareness has increased. So now you can actually measure, because there are surveys which people have conducted about preparedness of nurses and doctors. There are surveys which people have looked at, where the knowledge gaps are, and therefore how can you improve those knowledge gaps. So I think research has increased in that arena, and practices, the change in practices would tell you actually that yes, there is a change in the provision of services, how we do it, and that's how we will be able to measure in future. And I think these things are evolving every day. So in future, hopefully, we can do it in a more robust way. But definitely, if you look at the studies, if you look at the stuff which is conducted today, and what the results which these studies demonstrate are much different than, not in terms of may not be in terms of provision of services, there may be little improvement, but you could see the shift happening. You could see a recognition, at least people realizing that this is an issue which needs addressing. And I think that's a very good milestone, if you like.
I agree. And obviously in your sort of academic career, and obviously program director, you're senior lecturer at Sheffield in regards to nursing studies. How have you sort of seen the education evolve, if you like, over that period for nurses?
Some of the stuff keeps on changing in terms of the challenges and the understanding that we have of different issues in the world is evolving anyway, and that has then had an impact on nursing education. Also, shortage of nurses. It doesn't really have the impact on the existing programs, in terms of we don't try and churn nurses out so quickly in terms of degree programs and stuff. But then the associate program is something like, for example, is built into that sort of aspect that you need to do that. And technological advances. So now we know that nurses deal a lot more with technology. That technology is already gone into the hospital sort of arena and clinical setting. So I think those kind of elements, integrating them into education, has changed. Provision of education, before it was not possible to use technology it was always kind of, you have to be in the class and do it. Now you've got more options to choose from when you're teaching, and as also supporting. So I think that element has definitely increased. Role of nurses is becoming more and more challenging, more and more autonomous, more and more diverse. And I think preparing nurses for those sorts of aspects has changed and is changing continuously. I think in the last the growth and development with regards to information technology, internet and other services has been, in past 10-15 years has been kind of, it was very, very quick, wasn't it? So I think which then means that you have to be responsive to it at the same pace. So I think that has changed a lot. The demographics of the students who we get and why they're interested has changed as well. Nurses have started like myself. So, if you go into research, if you go into public health arena, if you go into research, which is outside clinical areas as well. So your nurses are expanding their scope, and therefore then they are contributing to the profession, but at the same time making nurses' place into other disciplines. That has increased. So more interdisciplinary work has increased, and I think as a result, our confidence, our nurses' recognition at one end has improved. But on the other hand, if you look at media and how nurses are portrayed and some of the other stuff, there is still a lot to be done about image of nursing, about people understanding what nursing is all about. What is it that nurses actually do? Because I don't think people still understand those sorts of aspects.
No, we agree.
Yeah, but I think nursing overall is evolving and has responded to the changes in demography, in changes in the how healthcare system work, has enabled a lot of changes in the education. The other aspect is like nursing is becoming more and more sort of a global. There's more global recognition, and it's nursing has always been portable one. So you have nurses who have always been able to work from one part of the world to the other, but recognition that we develop nurses not only for one country or one particular healthcare system, but we want to develop nurses who can actually serve in any healthcare system, has increased. And that's the demand of the time. And I think those aspects have changed over time. So, before people were only looking at the local needs. Now you see that, yes, we have got local needs, but then they need to be able to work in any healthcare system. And as we said, in diverse roles in different settings, not only in clinical area, but we're trying to ensure that nurses, a graduate nurse, when someone becomes is ready at that stage, they have got the ability to think critically, they have got the ability to make decisions, they have got the ability to stand up and lead situation as a leader. So all those aspects which make them an independent and autonomous practitioner, they're more accountable. So I think that has strengthened, I would say. I wouldn't say it wasn't there before, but I think over years it has been recognized or established more, and therefore we have been able to as educationists and as academics, we have been able to kind of work on those aspects more, if you like.
And tell us a little bit about your work. You're chairing the School of Nursing and Midwifery Research Ethics Committee.
Yes, I do. Yeah.
What does that entail?
So in that role, what we do actually is that any research study which is submitted or which people would like to explore further, our job is to ensure that it meets it is ethical and moral, and it meets the standard of, and the researchers have looked into the aspects of autonomy, like all of the ethical principles, making sure that people who participate, their rights are protected always. They have their anonymity, their confidentiality, their right to participate into a study or right to withdraw from a study is always protected, and also that it's not too onerous for them. So it's basically ensuring that participants, whoever they are, which could be healthcare professionals, which could be patients, because the kind of stuff which we do, which could be general people in the community, but we do not cause them any not so much any harm, of course, but we do not cause them undue distress or anything which affects their rights are protected, basically. So when studies are submitted, so then we try and allocate them to independent reviewers who look at the plan, and then if they have any questions, they go back and ask about those questions, and the researchers have to, it just makes them think properly about how you're going to do this. So having a good plan to do your research conducted in a very ethical and moral manner. And this is a very common practice among all universities in all disciplines everywhere. not only the UK, but around the world. Some countries are a little bit behind, but they're developing in that sense. So yeah, so that's what we do. And there are different ethics committees. So in the universities, you have university ethics committees, which then are, you probably have branches in different departments look at it, but then you would have other committees like NHS Research Ethics Committee, who look at the studies which are considering involving people from the NHS or from any healthcare setting. There are ethics committees which look at people who, if you're working with patients in nursing home, for example, or any other institutionalized setting. So they look at those sorts of aspects. And it's not only that, but then you have to go through different other permissions, appropriate permissions, asking from the gatekeepers who are responsible for different things. And I think the main aim is to ensure that public is protected and their rights are protected, and the research conducted is ethical, value for money, and useful for the society.
And what would you sort of say with your varied roles? What's the sort of most interesting part of your role?
I think all of those different things make it very diverse, make it very autonomous, and I think that's what I like about my role. That that not any day is, not one day is same. So you may be so it's very different. You're doing very different things in different capacities. But I think the best one is teaching students. So I teach students from undergraduate to post PhD, to up to the PhD level. And it's making a difference to them. It's seeing your students growing and developing during the program, which is more satisfying. And it's challenging at the same time, because not two people are same. They have got different needs. They've got different learning needs. They've got different ways of learning. So it's adapting yourself to meet those needs and to facilitating them to achieve their objectives is challenging and as well as rewarding.
And well, talking about rewards, you've won the Mary Seacole Award.
Yes,
and the Emerging Nurse Researcher Award from Sigma.
Yes, I did. Well, you know a lot about me. I'm very good at selling myself or saying anything about it. I'm not very good at all. I just forget everything basically. Yes, the Mary Seacole Leadership Award is through RCN, in Department of Health, and some other organizations, which is basically aimed at nurses from who are working on the issues of Black and minority ethnic related aspects, so diversity related aspects. So there are usually two awards each year. One is Leadership Award, and the other one is called so one is Mary Seacole Leadership Award, and the other one is Development Award. So basically, they help you conduct some research. They recognize the contribution of the nurses who have been given those awards, but then they allow them to work on a project which they think is of value and is going to contribute to the to improvement in the quality of care to people. So I won that one in 2015-16. And Sigma is an international organization, largely which started off from US, but has got branches everywhere now in the world. And we have got a chapter called FIMU chapter here in the UK, in England. We have got several other chapters in Scotland and Wales as well. So this award, Emerging Nurse Researcher Award, is something which looks at your which looks at Europe level. So we had about 6 chapters in the Europe, and I am the first one to be awarded as Emerging Nurse Researcher Award. So a nurse whose research has an impact globally on the populations they serve. It's just basically a way to encourage nurses to be more research active and to recognize their work, and then to ensure that future generations have something to aspire to, and that we keep on developing as we move on.
Fantastic. And just looking back at your career, Parveen, what would you, if you just speaking to yourself when you were going into nursing many, many years ago, what would, is there any piece of advice or anything you would have changed in your career?
If I had to go back
and give yourself some advice when you were starting your career in nursing?
I think an advice which I would give to myself, as always, would be to be more confident and on your ideas, be more confident on what you think, and be more, yeah, and look for opportunities if you get some, and work hard.
Very good.
And I think that's not only for me, I think for everybody.
And what do you sort of see the sort of 2-3 main trends for nursing coming up in the future?
Well, shortage of nurses is one thing. I think that's a global phenomena, which is, and somehow we need to tackle it because it's not going to change soon, and we really need some radical aspects to deal with it. The other thing is recognizing the nursing all degree program in many countries. That has already happened. UK is one of them, but still there is a long way to go in many other different countries to make sure that nurses get into the degree up to that level. Nurses role is going to be diverse. It's going to expand like anything. It's going to be even more diverse going forward. So I think being ready to have that kind of having students, having registered nurses ready for those sorts of role is something that is always there. Technological advances is something which are going to increase, and nurses have to be able to cope with those changes, I would say. So I think those three things, many other aspects, but I think these are the three things which are constantly going to be changing going forward.
Very good. And obviously, with your role, educating the future generations of nurses, what, why would you recommend someone, if they're coming in as a student, to go and pursue a nursing career?
Why would I think one should go for a career which they like going for, and which they're ready to go for. I think for me, nursing is, as I said, it is a profession which is very challenging, which is very diverse, which gives you a lot of opportunities to not only serve people in very difficult situations in their life. So you become a change agent. You have an impact on people's life, real impact. You can make small differences, big differences, but you can make differences to people's lives. So I think that's something which is very, very rewarding. The other thing is for you as a nurse, for you as somebody, it's a very diverse and challenging and stimulating place. So if you're somebody who don't want to um, limit yourself to one thing, kind of a similar sort of task or job, nursing is for you, because not 2 days are same. If things are different every time, you're exposed to so many different challenges all the time. So you're always learning, you're always developing. And also, if you would like to progress in your profession, if you are ambitious, if you are career focused, nursing is for you. Because yes, it may sound like, and as I say, the image of nursing is still like, okay, fine, you've got nurses only work in hospitals, but that's not the case. There's even the sky is not a limit for nurses, because you've got so many different diverse um, uh, possibilities within the profession, outside the profession, that you can choose from. There are so many developmental opportunities, you may start from a degree, but then you can go up until PhD. You can be you can the opportunities are limitless. So if you're someone who would like to have diverse opportunities, who would like to have challenges, I think nursing is for you. And above all, if you're someone who would like to explore the world, nursing is for you. Because I think as nurses, you can go anywhere in the world and can work. And it doesn't only give you the skills to be able to adjust to different populations, different places, in different countries, but it also gives you it is a profession which exists everywhere. So your job is guaranteed. It's not that you're going to be a nurse in one country, not in the other. You may have to go through registration process and all that, but it's kind of your passport, which can be used everywhere in the world. So so I think if someone is looking for a challenging, rewarding, stimulating profession, something which changes their life, nursing is for them.
Fantastic. And is there any sort of message you'd like to pass on to our nurses that are watching this today?
Believe in yourself, believe in what you do, and every day you do make a difference to someone's life. And I think recognizing that is important. I don't think we do. We recognize that enough, and I think support each other. I think in doing everything that we do, we often forget to take care of ourselves and take care of our colleagues who are around us. So I think it's just that we need to be mindful of and be nice to ourselves as well. So yes, we do it for everybody else, but do take care of yourself and do take care of your colleagues as well. Yeah.
Super. Parveen, thank you so much for your time today.
Thank you so much. Thanks a lot. Thanks for having me.
Very, very, very welcome. Thank you to all our nurses, doctors, allied health professionals and carers. Thank you for watching The Voice of Nursing, and we'll catch up with you again soon.